Welcome to our channel once again. Today we are very privileged to be talking about a topic that is very common across the world. Today we are going to talk about hypertension, also known as high blood pressure in the layman's language. High blood pressure is the leading cause of death worldwide, whichever way you look at it. And it's affecting about 1.5 billion people. You know, we are about 8 billion people, and 1.5 billion people are actually having high blood pressure. So that means as you come across the way or as you see your friends, it is most likely that 1 in 3 people is actually going to be having a problem with high blood pressure. So what is this high blood pressure? High blood pressure is when we have the pressure from our bodies being higher than the recommended levels. You see, the pressure comes from a function of the heart beating. When your heart beats, which is about 60 beats per minute, it has to send the blood to the rest of the body. And in order for it to do that, it has to generate a pressure, which sends the blood through the blood vessels. And this blood takes what we call nutrients to the rest of the body. But if these nutrients meet any resistance, the heart has to work harder. So we have a measurement which is up and a measurement which is down. The measurement up is what we call the systolic blood pressure, when your heart pumps. And when the heart pumps, of course, it has to relax. When it relaxes, that is what is called the diastolic pressure. So we have a range in which this blood pressure is supposed to be. The upper one, which is also called the systolic blood pressure, is normally supposed to be between about 100 and 140, and the lower one is supposed to be between 60 and 90. So when we exceed those upper limits of the blood pressure, then we say this person actually has high blood pressure. Whenever you go to the hospital, you should make it a point that even if you've gone for malaria, when you have a fever, you should make it a point that the person who is going to be seeing you takes your blood pressure. Fortunately, now we also have home-based gadgets where you can easily just put your hand there, relax a little bit, and the machine takes your blood pressure and it gives you a value which is up and down, which is called the systolic and diastolic. And so this blood pressure is a very big issue. We usually have risk factors for it. And the majority of people think that the people who get blood pressure actually have to be very big. They have to be eating chips and chaps. Things have changed a little bit. You can't know who has high blood pressure and who doesn't until we take this blood pressure. The commonest cause of blood pressure usually comes from familial inheritance. Blood pressure is divided into what we call essential blood pressure, which you usually inherit from our parents. If your parent, a sister, brother has high blood pressure, your risk of having high blood pressure also increases. But there is also the secondary form of high blood pressure, which we call acquired blood pressure. And that one usually comes from our lifestyles. If you have diabetes, if you have a big body mass, that means you are obese, to say the word, then your risk of getting blood pressure also increases. If you eat a lot of salt, if you don't do exercise, if the food you eat is lacks fruits and vegetables, then you are also at increased risk of high blood pressure. The main challenging problem with this high blood pressure is that it often presents with no symptoms. So you are unlikely to get disease like we do with infectious diseases. This is part of the series of the non-communicable diseases, as we call them. These diseases are not transmissible from one person to another. And so they often get very little attention until it becomes a very big problem. The fear and the challenge of high blood pressure is that it presents as a 4-barreled gun. It causes complications. One barrel is pointing to your brain, so people usually present with stroke, weaknesses on one side, and the other is presenting to your eyes. The barrel is pointing to your eyes, so people usually present with blurred vision, and they can actually lose their sight and become blind. The other barrel is to your heart, and that's the common most people know. So high blood pressure can actually cause heart complications. This could be myocardial ischemia, where you stroke out and die. This could be actually heart failure, which mainly presents in people. You get easy fatigability, you are not able to walk the distances you used to walk. You get swelling of your body, particularly the feet, even before you do much. And basically, you get easily fatigued even for doing easy chores at home. That's the third barrel. The fourth barrel actually points to your kidney, where you get kidney disease. We'll be talking about some of these organs in the next series, but today we'll stick to the high blood pressure. So the high blood pressure, you need to measure it. You need to go to the hospital in order for you to know, so that you don't get into these complications. The next question is, how do people with blood pressure know that they have high blood pressure? So if you get palpitations is actually increased awareness of your heartbeat. Normally, when you are walking, moving around, you should never be aware of your heartbeat, just like you should never be aware of your breathing. These are natural phenomena given processes to us. They are physiologically normal, but the moment you begin to get aware of your heartbeat without doing an exercise or having exercise, then you probably have high blood pressure. The other problem or the presentation of high blood pressure is when you get body swelling. When you begin to get body swelling, especially of your feet, you probably might be having high blood pressure. The other time you actually get to know that you might be having high blood pressure is when you get tired easily. For instance, if you used to be, and this depends on your fitness levels before, you used to run 100 kilometers in 15 seconds, and now it takes you about 2 minutes to run. So when you begin to lose that concentration, you probably have high blood pressure. So how do you avoid this high blood pressure? The best way to avoid high blood pressure, one, is to first establish whether you have it or not. Look at your family history. Is any member of your family having high blood pressure? If they do, then you are also likely to have high blood pressure. But blood pressure is mainly avoided, the complications, by making sure that you live a healthy life. This requires you to exercise at least 30 minutes every day. It requires that you eat a lot of fruits and vegetables, which will in turn help your heart to work better. You avoid eating a lot of salt in your food. We consider a lot of salt as a teaspoonful in 24 hours. And then whenever you don't feel well, you should actually go to a hospital or to a nearby health facility and get checked. So I hope that in these few minutes, you've learned about high blood pressure and that you are able to go and get checked for high blood pressure. So I want to thank you for listening to us, and I hope that after this session, you go and you have your blood pressure checked. If you feel that this message is important to you or to someone you love, please go ahead and share it, and in so doing, you might actually save a life. Thank you very much.